Good afternoon. You are watching the first installment in a series entitled Where the Belief Returns. This program will air weekly on VTV1, Sundays at 12:45 p.m. The majority of HIV cases in Vietnam are among injection drug users who have shared needles and syringes. So interventions targeted at this group naturally play a very important role in reducing the number of new HIV cases. Our program, Where the Belief Returns, is designed to offer useful knowledge and information on HIV prevention to everyone, with a special focus on interventions among injection drug users. Throughout this program, we hope to send a message to all people living with HIV and those still practicing high-risk behaviors, especially injection drug users. Let's find the belief again to live positively. Let's find the belief again in ourselves and our loved ones, and in every member of the community. Haiphong, the bustling northern port city, was one of the first areas hit by the heroin epidemic in the 1990s. Through this report, we hope that all of us, especially injection drug users, could have more understanding and know what to do to reduce HIV infection risk for injection drug using groups and the community. Statistics had been shown that the majority of HIV infections were injection drug users. They account for over 50% of cases and were infected mainly by sharing needles and syringes. According to 2007 Sentinel surveillance, HIV prevalence among injection drug users nationwide was very high, at 20 HIV infections among 100 injection drug users. TV, newspapers, posters, and billboards on the street in Vietnam often carry strong messages about HIV/AIDS, and the behavior that spreads infection and public awareness has improved. But it is still not enough to ensure behavior change. There is still a large gap between changed awareness and changed behavior. Many people across the spectrum still stigmatize people living with HIV and AIDS and injection drug users based on inaccurate information.
As I understand it, this advertisement means that the experts provide counselling so that the public will know about it and prevent HIV infection. Husband and wife should be mutually faithful.
In your opinion, what types of measures should injection drug users take to reduce the risk of HIV infection? On this sign there is a system of domino cards. Looking at the cards, anyone can understand and stop on time. It's just like a green light means go and a red one means stop.
The sharing of needles, syringes, and other injecting equipment is a major risk factor for transmission of HIV. Yet, injection drug users throughout the country continue to do it. We captured these shots early in the morning in the Dinh Hang area of Haiphong. Although injection drug users know HIV transmission routes, many simply brush it off based on myths such as, having shared needles with my friends so many times, it is in vain now to use my own needles. Or, sooner or later, becoming infected with HIV is unavoidable. Or, when you're craving drugs and the whole group has only one dose to share, how can you use your own needle? As long as these attitudes persist, there will be need for focused information, education, communication, and behavior change communication, and support services to help injection drug users change. This goes much further, however, than simply saying you will get HIV by sharing needles and syringes, and instead should carry the message, if you are HIV positive and you are still sharing needles and syringes, you will not only transmit HIV to other people, but you may also contract other diseases such as hepatitis B, hepatitis C, and drug-resistant HIV, compounding your illness even more.
Why do you think that some people are still sharing needles and syringes? Those people often go out late in the evening, so late that they can't buy needles and syringes. That's the first thing. The second thing is that they're in a craving for a drug, and they're not sound of mind. Their eyes blur.
Chúng tôi phải đi tiếp cận với những người sử dụng ma túy
We have to reach drug users and conduct a full procedure of contact. For example, each contact must comply with the club's criteria, which is set by the supervising educators. These criteria include preparation of sufficient materials, wearing outreach clothes, and then getting acquainted with clients. Once we become acquainted with clients and have gained their trust, we explore the risks that they may encounter during the course of their drug use. After we discuss the issues with them and they indicate that they want to stop, we offer counseling and we refer them to services that are free of charge to drug users. You can see here how drug users and the general public are more aware of what is outreach work. People used to think that we were doing little other than helping drug users to continue their habit, but now people recognize our work for the social benefits that it offers. And most drug users are now aware that sharing needles and syringes is very risky because they may become infected with HIV/AIDS. As a result of our work, most drug users now use their own disposable needles and syringes, and the public sees us in a positive light. They know that our efforts bring back significant social benefits.
Về bơm tiêm là người ta rất là tốt, dùng riêng, hầu như người ta dùng riêng và dùng một lần. Còn những cái người dân người ta nhìn vào chúng tôi với một con mắt cũng khác, người ta biết rằng công việc của chúng tôi là đem đến những lợi ích xã hội.
Haiphong has one of the highest HIV rates in the country. There is also a high proportion of HIV-positive injection drug users. Community outreach is the most effective measure amongst active injection drug users. Community-based behavior change communication is an initial step only, and drug users should be referred to clubs in their area where they will receive more comprehensive services to help reinforce positive life changes. The Hai O Club in Haiphong has employed a successful model since 2000. Most members are recovering injection drug users. We joined them in one of their twice-weekly recreational education sessions recently. These sessions include thematic talks, knowledge contests, table tennis, chess, reading, and karaoke. Injection drug users receive a free health checkup, medicines, and risk reduction counseling when they attend. Participants are very enthusiastic, and many of them have successfully detoxified. Here, club members feel the club like a second home, which is completely safe. When they come here, they have no need to feel inferior anymore, and the site has become a second home to many. It is a supportive environment, and it works.
Những hoạt động can thiệp tầm hại của thành phố Hải Phòng đã được triển khai ngay từ năm 1997 năm 98.
Interventions began in Haiphong in 1997. From 1998, harm reduction interventions have been underway. And the first project was conducted in Ngo Kian district and Lê Chan district. Since then, we have scaled up harm reduction across the city, and in 2000 we established the Hai Ao Seagull Club with FHI support. We've scaled up harm reduction across the 14 districts of Haiphong with information, education, communication, IEC, communication activities to large and small groups, community outreach, distribution of leaflets, and contacts with injection drug users to provide them with the knowledge on HIV/AIDS prevention. This harm reduction also focuses on distribution of clean needles and syringes, distribution of condoms, and implementation of the 100% condom use program. In 2007, we distributed more than 2 million needles and syringes and 1 million condoms in the community through traditional and non-traditional channels. As a result, new infections have reduced. In 2002, there were 1,000 new cases of HIV detected in Haiphong, but in 2007, there were only 300. Those harm reduction activities have reduced the number of newly infected cases and mitigated the negative effects of AIDS pandemic in the community, especially for injection drug users in Haiphong.
Những hoạt động can thiệp tàn hại đó đã làm giảm cái số nhiễm mới, giảm tác động của HIV/AIDS đối với cộng đồng, đặc biệt đối với người nghiện chất ma túy tại thành phố Hải Phòng.
In my spare time, I come here to read books, stories and materials so that I can learn more about drug use and HIV. Since the day I joined the Hai Ao Club, I have gained much more knowledge about my drug use. Here I've also made friends with whom I can talk when I face difficult times. The clubs provided me with counselling and referred me to the AHF clinic at Tư Nguyen Hospital for treatment. My health has gotten so much better since then.
Tư vấn cho tôi và giới thiệu tôi đến phòng khám của AHF, bệnh viện Thượng Nguyên, tôi điều trị. Nên từ đó nên là sức khỏe tôi rất là tốt.
Stopping the spread of HIV among injection drug users calls for a comprehensive approach. Community outreach and clean needle programs remain the most effective way to reduce transmission. This goes beyond simply supplying free needles and syringes and into assessing risk behaviors, offering risk reduction interventions, referral to voluntary counseling and testing for HIV, treatment of opportunistic infections, antiretroviral therapy, and treatment of opioid drug addiction by methadone maintenance therapy. All this depends on a steady supply of needles and syringes, steady supply of condoms and easy access to them, access to counseling and testing for HIV to reduce risk among injection drug users and their sex partners, community outreach for behavior change communication, and methadone maintenance therapy. The scenes in this report are designed to provoke thought in the viewer, as they did with us when we shot the footage. The woman selling jackfruit along the street with a gentle smile and simple message of avoiding HIV by being faithful. The bright faces of members from the Hanoi Oi Seagull Club, who now know that using only your own needles and syringes can prevent HIV. The look of fleeting satisfaction on the face of an injection drug user as he comes onto drugs early in the morning, hopefully thinking, even though I shared needles many times in the past, it is now time to change using my own injection equipment. The faces of peer educators who have overcome their own addiction to provide behavior change communication for injection drug users. Communication on all of these issues is vital to stopping the spread of HIV. It begins at the support from community, from you, and here, with the people in this program, educating themselves and others on safe sex and safe injection is the key. The key message to be sent to all drug users is no sharing, no HIV and other diseases. No sharing needles and syringes will protect yourself, your family, and your community. We look forward to being with you next week when we will look at piloting integration of drug abuse treatment into prevention, treatment, and care in Ho Chi Minh City. Goodbye and see you again.